Hey everybody, Dr. Sandal here talking about breaking the boundaries of mainstream medicine. So I've been a little fiery recently talking about other MDs and the system that they work in. And I want to talk a little bit more today about some of the pushback that I get on these things. It's not uncommon for people who haven't explored integrative medicine or functional medicine to think that this stuff is a hoax, to think that there's not much value to this, or to think that it's unscientific. And those are really important critiques. What I'm here to do is invite the MD community and patients to push for better healthcare. And the scientific methodology used in medicine that all MDs get trained rigorously in is an absolutely beautiful thing. The trouble with mainstream medicine and why I'm pushing boundaries on that is that rather than being genuinely scientific, we fall into orthodoxies. We fall into dogma. Physicians go through 4 years of medical school training. And of course, that's after college, it's after all their regular schooling, right? 4 years of med school, then they do their residency. And the function of residency is an apprenticeship, if you will. You work with doctors in your field, so maybe gastroenterology or family medicine or psychiatry or whatever. And you learn from them how to do things. Now, in some regards, that can be at odds with the scientific methodology that you learned in your first 4 years. What do I mean by that? In your first 4 years in medical school, you learn a lot of theory, you learn a lot of background stuff, and you think about the science of things. In your residency, which depending on the specialty is going to be another 3 to 12 years, lots of training. You're not necessarily thinking about the science, you're thinking about what works. It's almost a sort of trade apprenticeship. Now, it is foundationed on this, so don't get me wrong, it is a scientific practice, right? It's based on these methodologies, but it's much more about how do we get stuff done routinely? You see this problem, here's your options. You see this problem, here's your options. You see this problem, try these things. That doesn't work, maybe you do this. Now, what's the problem with this? The problem is that it gets you thinking on rails. Because you have a busy day as an MD, you just have to get stuff done. And you're intelligent and you're compassionate and you want to do a good job. So how do you do that? How do you manage all of the stress and time pressures of that? Well, you revert to your training and say, okay, yeah, this is what we usually do for this. This is what we usually do for this. I remember in residency, we did this, we're going to do this. And then you gradually start to build out your own experience and you say, okay, I'm going to vary that a little bit based on, my mentors told me this, but I've kind of learned this. This new medicine came out, okay. And you mix it all together and you have a set of standards that you engage with. Now remember, most MDs are going to spend about 10 minutes with you. I think that's the most recent average that I saw published. All they have time for is to do that cookie cutter approach. Again, smart, compassionate people, but they exist in a system that doesn't necessarily serve your health. So you have to advocate for your health, and I just did a video on that. Go check it out. You do that respectfully. And what ends up happening is in mainstream medicine, they lose a scientific methodology. They get to a point where they aren't functioning the way that they meant to, the way that they trained to. Instead, they are going to their toolbox and saying, okay, here's what I have in my toolbox. Are you a nail? Because I have a hammer. Is it in there? Here it is. No, it's not there. Oh, let me send you to another specialist who has a different toolbox. Right? What happened to being scientists? What happened to sitting back and thinking, okay, well, hang on, what really is going on with this patient? What am I missing here? How do we solve this problem? You don't really see that very often in medicine anymore. There's a lot of knee-jerk reaction. Send them to the specialist. It's a gut issue. It's complicated. I don't know what it is. Send them to the gastroenterologist. But the gastroenterologist does the same thing. Fundamentally, in medicine, we can either do things in a reductionist fashion or an integrative fashion. We can treat you as a whole person, or we can treat you as a set of non-interlinking systems. Guess which one of those you really are. Right? So when you see these different specialists for these different issues, they often don't know what the other ones are up to, or they don't know how it interacts, or they don't think about Oh, I'm giving you a statin to help reduce plaque in your heart, but what does that do to the kidneys, right? That's an after effect because it's just not their field. So when I talk about integrative or functional medicine, I'm talking about a scientific process. I'm talking about an advanced scientific process. I'm talking about a progressive scientific process. I'm talking about gathering data. I'm talking about running interventions and seeing how that data changes. You want to work with a doctor who's going to see you as an individual and be a scientist. That is especially true if you want great health. If you like the status quo, stick with the status quo. Don't get me wrong, there's a lot of excellent things about mainstream medicine. You get hit by a car and need a surgery, heck yeah, those guys rock. They're great. But if you have chronic illness, or you want wellness, you want longevity, that's often a much more complicated project than exists in that toolbox. So you have to go to the person who thinks scientifically about you as an individual. That's the heart and soul of integrative and functional medicine. So I hope that kind of helps create a little bit of clarity on this. I really, I'm fiery about this. I'm passionate about this. I want MDs to challenge themselves. I want patients to have a higher expectation for their healthcare. If you guys have any questions on this, if you want to engage on this, if you disagree, heck, let me know. I'm happy to talk about these things. If we all talk about these things, we're going to end up with a better product. What we don't want is just to blindly accept the orthodoxy. Make sure to like and subscribe. We'll get more into this. And let me know your thoughts below.